Adam Marles, President and CEO of LeadingAge PA. What does your group do?
LeadingAge PA is a trade association. We represent not-for-profit aging services in Pennsylvania. So what that means is we represent retirement communities, skilled nursing facilities, assisted living and personal care homes, but also at-home services, so home care, hospice, home health, and the life program, for example.
And at what rate is Pennsylvania's senior population growing?
Well, right now, Pennsylvania has the third most seniors in the country, and it is growing significantly. The demographics show that over the next 15 years, we're going to see a significant increase in the number of older adults in Pennsylvania.
Now, the main reason we have you here today is to talk about nursing homes. So tell us about the care a person can expect if they're a resident at a nursing home.
Sure. So people who stay in nursing homes typically need 24-hour-a-day care. So it's nursing care. But in a nursing home that's providing excellent quality, they're also seeing activities, they're seeing social workers, they're seeing volunteers who are keeping them engaged and giving them good experiences. One of the things that we're really interested in is changing the perception of nursing homes in Pennsylvania. Historically, people have thought of them as institutional and places that you really don't want to go. But I think what you'd find if you go into a nursing home today is there's a big difference between a nursing home in 2019 and a nursing home in 1975. The engagement, the activities, the amount of interaction that people have really make for a high quality of life, even though they are in need of services and care 24 hours a day.
What about the people that work there? Are they very different than the ones that worked there in 1975? Maybe their training is different.
I would presume that the people are very much similar. The people who are called to this work, they're called to care for people. They are individuals who truly are the heart of caring for other people. There are definitely more requirements. There are more regulations now than ever. The saying goes that we're the second most regulated industry in the country behind nuclear energy. So it's a tough industry to be in, and in fact that has created something of a workforce challenge for us. Obviously nationwide, because unemployment is so low, it's hard to find employees in lots of different industries, but in particular because this work is very difficult. You're caring for people in a very intimate way. Oftentimes, it's hard to find workers until they get into the business. And the magical thing about aging services is that once they're caring for older adults and they're developing relationships with people and hearing the wisdom and the life stories of the people that they're caring for, then they tend to stick around for a long time. But getting them into the field initially can sometimes be difficult. So
you said you're a heavily regulated industry, so talk about some of the changes that have taken place.
So, for instance, the amount of paperwork, the amount of tracking of what goes on in nursing homes is significantly increased over what it was. So what's happening is that nurses who typically were spending a lot of time at the bedside are now spending a lot of time making sure that they're dotting I's and crossing T's, which is appropriate to a certain extent to make sure that care is being provided the way that it should be. But the regulations have gotten to the point where they're spending so much time not providing care that we're having to hire extra people just to do the paperwork. And that challenge is tough, especially in a budget environment where our industry hasn't seen significant increases in funding in some time.
So let's try to put nursing homes in the overall context of caring for seniors here in Pennsylvania. In other words, where does it fit in the range of choices as to how we care for our seniors?
So the range of seniors goes from the typical family caring for someone at home through bringing in care, whether it's Medicare certified home health or home care services. Sometimes it's just not safe or it's not the appropriate place to have someone at home anymore. In particular, we're seeing a significant rise in the number of people with Alzheimer's and related dementias. And caring for those people as that disease progression occurs can sometimes be very, very difficult, not only for the person suffering from the disease, but also for the caregiver, especially if they're still a working person. We hear a lot about the sandwich generation, and the sandwich generation in particular, trying to raise children while also caring for older parent can be especially difficult. So at that time, often they'll need to move into a facility-based residence, whether it's assisted living or personal care designation that is relatively unique to Pennsylvania, or onto skilled nursing. And then in the middle of that, for people who don't necessarily need care right now, is independent living. So one of the areas that we represent most are continuing care retirement communities, which provide a continuum of care from independent, which is exactly what it sounds like, residential living, as if you were living in any other apartment or cottage anywhere in the Commonwealth. And then as their care needs progress on a campus, they can progress along with the people that they know and have come to trust and make sure that the care they need is provided.
So approximately how many Pennsylvanians are residents in nursing homes?
We've got tens of thousands of people in nursing homes right now across the state.
And how has that changed over, say, the last 5 years? You said you have more Alzheimer's patients these days.
The number of people being served is staying about even because home-based services are getting so good, and also because healthcare is improving. Some people who used to come to skilled nursing facilities for rehabilitation care can now go directly home. And so although the demographic trend is showing more older adults, the trend in nursing homes is about even.
So about how many Pennsylvanians work in nursing homes? Just how big of an industry is it statewide?
I would estimate it's somewhere around 100 to 150,000. I'm not sure exactly off the top of my head.
And well, roughly how many, I'll try to press you for another number here,
Sure.
About how many nursing homes do we have statewide? I mean, I'm guessing hundreds.
Oh, definitely. It's between 500 and 600.
And I want you to explain to our audience the distinction between representing nonprofit nursing homes, which you do,
Certainly.
and the for-profit nursing homes. So why should that distinction be important to our viewers?
So obviously the reason for a not-for-profit to exist is to care for people. The driving force behind an investor-owned or for-profit nursing home is obviously to deliver some profit to a shareholder or to an owner. And so for our members, when they see a profit year over year, and obviously they're trying to make some margin so they're not losing money, but when they see margin, it's reinvested in the services, reinvested in the capital plant for the business itself to make sure that care is improved and always getting better. And that's a significant distinction. The other thing is, because they're investing more, oftentimes they're able to spend more on the actual care. So on average, you can see, we had a study done recently just to try to highlight exactly how much it was costing our members to care for people in their nursing facilities. And if they're on medical assistance or Medicaid, then our members are losing money. And for not-for-profits, they're losing about $82 per resident per day to care for people. For-profits are losing about $27 per day per resident. And what you see there is a significantly increased investment in staffing and quality. And that's really because the investment goes back into the services.
And talk some more about why this distinction is important to our viewers. In other words, as far as the cost is concerned, I'm guessing if you go to a privately owned nursing home, it's going to cost more.
Typically, it's not necessarily going to cost more. It's probably going to cost about the same or maybe even a little bit less because, again, services are not always complete. That's not always the case. I don't want to shortchange. There are some very excellent for-profit providers in the state of Pennsylvania. There's some on either end of the spectrum, of course.
And talk some more about the issues you have to deal with then as far as nonprofit nursing homes versus the for-profits. Are the distinctions, or the concerns rather, any different?
The major concerns right now are actually pretty well in alignment. The biggest issue that we're dealing with right now is a lack of funding at the state level.
And we're going to talk more about that soon. First of all, let's consider the average cost, say, of staying at a nursing home in Pennsylvania.
It's about $120,000. It can go up to $140,000 depending on where you're staying, but that's about right.
And just putting this in context, how big a toll does this take on the average family budget? How do they make ends meet?
Obviously, it can be very difficult. For people who are paying privately, some people have long-term care insurance. Over time, the long-term care insurance industry has really taken a battering because of some bad actuarials in the past. As people have lived longer, as costs have increased, long-term care insurance companies haven't always been able to keep pace, and so getting those policies has been tougher. So if you don't have long-term care insurance and you don't have a significant amount of wealth, it can be difficult. And so often you see people do spend down their resources and end up relying on medical assistance to get the care they need.
Just how popular are those, the policy you just talked about?
A long-term care insurance policy.
Sorry, exactly right.
Sure.
The long-term care. Are those policies very popular?
They're less popular now than they were in the past.
And what happened?
What happened in large part was that the actuarials that the insurance companies were using were off, and so there were some insurance companies that ended up actually going out of business. And so insurance companies generally are less likely to offer those policies than they were in the past, which is why they're not as popular.
Because at a glance, it looks like it's something that someone would be interested in.
Absolutely.
Given these costs we've just talked about.
I think that's true, but at the same time, people are often a little bit hesitant to think about these issues for themselves. It seems so far off. It seems like something that won't happen to them. The statistics say that at some point in the average person's life, 70% of people will spend some time in a nursing facility. So they may not live there permanently, but whether it's for a rehabilitation stay or for some other reason, the majority of people will actually stay in a nursing facility, according to the statistics. So I think it's more to do with, I don't want to think about this in my life, so I'm not necessarily going to think about it, and that leads to less of these policies being taken out, even though there are less than being offered as well.
So let's talk about the typical pattern for paying down services. Obviously, residents starts with their own resources, their own assets, and when they're exhausted, then what happens?
Then typically the facility will help them apply for medical assistance through the state, and then medical
Namely Medicaid?
Correct. So medical assistance is the name for Pennsylvania's Medicaid program. So they would apply. There's a 5-year look back to make sure that funds weren't transferred in a way that they shouldn't have been. So for instance, sometimes people have tried to transfer their own funds to their children or to other family members so that they preserve their own wealth and try to keep it out of the hands of a nursing facility. So the state will look back to make sure that that didn't happen, and assuming that it didn't, then they become eligible, and the nursing home begins getting paid through medical assistance.
So what other eligibility requirements are there? For instance, I think you have to collect Social Security?
Correct. And you do have to spend down your resources, and obviously you do have to be nursing facility eligible at least to get payments in a nursing home.
And just to be clear, when Medicaid is able to pay the expenses, how much do they pay, 100%?
But they do not come close to paying 100%. So last year, I mentioned the study earlier that we had done. So last year alone, those providers who provided medical assistance care to people lost collectively, in Pennsylvania only, almost $632 million. So what that translates to on average is that a nursing home that provides care to people in medical assistance lost $45 per day per resident in providing that care. So the gap between medical assistance funding at the state level and the cost to provide care is significant. And it's grown more significant over the course of many years. So if you look at the cost of care over the past 15 years, the cost of care has gone up approximately 33% in that time. The average increase in the cost or in the funds provided by the state to provide the care has averaged less than 1% a year. In fact, over the past 10 years, we've essentially been flat funded at the state level. The only increase in the last 5 years was last year, when we got 1% increase for one half of the providers for one half of the year. So not nearly enough when the cost of care increased more than 2%.
Do all nursing homes in Pennsylvania accept Medicaid as payment?
They do not. In fact, some nursing homes don't depend on federal funding at all, but the majority of them do.
So that's a good question to ask if you're considering it.
Absolutely. And the ones that don't will definitely make that clear to you up front.
And furthermore, as far as eligibility is concerned, a doctor has to sign off on the fact that you need that certain kind of care.
Oh, absolutely.
And define that care as best you can.
Again, the crux of it is that they need 24-hour-a-day care, that it's not just periodic.
From a doctor?
Yes. No. The care doesn't need to be provided by the doctor. The care
but they do need some service from a doctor.
Correct. But the care is typically provided by nurses, licensed practical nurses, or certified nursing assistants.
So the main reason we have you here today is to talk about Medicaid funding. So about how much of the total Medicaid budget is available for nursing homes anyway?
I'm not sure what the total percentage is for nursing homes offhand.
Well, as far as the adjustment to Medicaid, as far as your funding is concerned, have you seen it go down in recent years? And is there a trend? And if so, why?
There hasn't been a decrease in funding in recent years, but it's been flat funded. So although the costs have gone up significantly over the course of years, the relative funding for nursing homes has, I guess you could say, gone down, but the actual dollars have not.
Well, talk about some of the major things that drive your costs now that are just increasing ahead of others.
So as I said earlier, part of it is the regulations have become onerous to the point where we're hiring extra people just to do the paperwork to make sure that we're doing what is required by law. So that's part of it. But another really big part of it is that the average acuity, the sickness of the people that we're serving has gotten significantly different. The people that we're serving now in the past would have been staying in a hospital, but as healthcare has improved, we've been able to care for people that previously wouldn't have stayed in a nursing home and allowed them to continue their lives in a non-acute setting.
So it sounds like there is more demand for nursing home services.
There's more demand for services, but there's also a different type of need being provided. So that means that we need to staff differently to make sure that we have enough people to provide the care that they need to make sure that their quality of life is good as they receive the clinical services that they need.
And certainly some residents are outliving their resources too, aren't they? Because in general, we're living longer.
Absolutely. So we talked about retirement communities earlier. It used to be that when people entered into a retirement community and independent living, we would see them move in their 60s or 70s. Oftentimes now, we're seeing people move into independent living in their 80s or even 90s and continuing to be independent much longer than they used to. Prior to this role, I used to work for a provider, and one of my favorite residents at that provider was named Alice. At 102, she was still living independently. She was still going across the street to volunteer in the healthcare center to help the old people because she wasn't there yet. And I think that's emblematic of the changes that we've seen in longevity.
You were quoted recently, Adam, as saying that 5 nursing homes, 5 of your members, are tempted to close their doors. Can you tell us what is the complaint they all have in common? Again,
it's all about funding and being able to provide care at the quality that they want to without being able to get the funding that they need to pay for it. So as they continue to do their work, as the deficit between funding and costs have continued to go up, they're faced with decisions. And what you're seeing statewide are some nursing homes making some very difficult decisions. So some are selling out to other providers. Several of them have sold out to out-of-state providers from other places that are typically investor-owned. And oftentimes what we've seen is that the quality of that care is not very good. There have been some reports by the Auditor General on some of that happening. So that's part of it. Another thing that we're seeing across the state are some of our providers reducing the number of beds that they have available in their nursing homes. So that's obviously tough. And now some of our members who are really committed to quality are facing some of these tough decisions. And the decision is coming down to, do I sell or do I just close my nursing facility outright because I don't trust the quality of the people who are trying to buy them? And that is a tremendous decision. So as we said, 5 different members right now across the state are facing these types of decisions actively.
So that sounds like a serious problem, out-of-state entities buying these nursing homes, and it changes the level of quality.
Correct. Correct. So as we try to deal with that, we are asking the General Assembly to consider an increase in funding for this year. The funding request that we're making is 2.8%. That's not a number pulled out of the air. Every year, CMS, the Centers for Medicare and Medicaid Services, the federal government, tell us nationwide what the cost of care increased by, so whatever that percentage is. Last year, the cost of care increased 2.8%. And so all we're asking is that the state keep up with the inflationary costs that our members are dealing with.
Any reaction from the administration or lawmakers in general as to this feasibility of this 2.8% increase?
I think as lawmakers have become more aware of exactly how dire the circumstances are for many of our nursing homes, the response has been generally positive. We're having conversations with legislators on a regular basis right now, and they're telling us that they're hearing from their constituents that this is a real problem and they need to address it. So we're hopeful that they will answer our call this year, and we're getting some positive signs that may occur. Especially, I'm sorry.
Well, the pressure is really on now because we have a few weeks until the budget is supposed to be finalized.
Exactly, and at least for this year, because the budget for the current fiscal year seems to have come back much more positively than expected, we're hoping that may also translate into some positive outcomes for us.
So your group, LeadingAge PA, has a presence at the Capitol at this time in order to interface with lawmakers?
Every day.
Now, I understand there's a program, too, that lawmakers put money into, and there's a desire on your part, I think, to get is it $17 million? First of all, what is the existing program and what can you do with that additional $17 million?
So the program is called Non-Public Medical Day One Incentive Payments. The non-public MDOI provides additional supplemental payments to nursing homes that provide care at 65% of the people they care for or more are on medical assistance, and they're at least 85% or more full. And so what this money helps to do is every year the General Assembly typically adds some money to this line to make sure that those providers who are caring for these exceptionally ill, exceptionally poor people are assisted. So it helps some of the nursing homes statewide, but it actually helps less than half of them. So what we're trying to do with our request of the General Assembly is to balance providing an increase for all providers who are caring for people on Medicaid, but also make sure that those who are providing an exceptional amount of medical assistance care are recognized for what they're doing and making sure that they are able to close that gap a little bit.
For just a couple minutes, let's try to take about half a step back from nursing homes in general and just consider Governor Wolf's agenda in general for Pennsylvania seniors. What is it the way you see it?
The way I see it, Governor Wolf has been pretty clear that he supports people staying at home, which we also support. We think it's fantastic that he really wants to see more people cared for at home if they can, and we support that. I think we haven't necessarily seen the support for people in facility-based care. In fact, this is the 5th year in a row where the governor has not provided any increase at all in his budgets for facility-based care, and so we're concerned about that. We want to make sure that changes. But we support both, and we recognize that generally people would prefer to be in their homes. We want to make sure that the care is available to those people as well. But in particular, people who have significant care needs can't often be cared for safely in their homes, and so it has to be both and. It can't be and or.
It seems the phrase aging in place is being used to characterize what you're talking about now, and that seems to dominate the conversation the last few years.
That's absolutely true, and that's going to be continued as technology it continues to be advanced, as healthcare continues to move forward and to provide better care for people as they age. I think we're going to see more of that, and generally speaking, that is cheaper, and so it's good for families, it's good for the state, it's good for everyone. It's good for the older adult, obviously, because they get to stay where they want to be. But over time, or if people need around-the-clock care especially, it can actually be more expensive to be cared for at home than in the congregate setting. And so we want to make sure that we're addressing both.
So it seems to me that you would be able to redirect the conversation somewhat to have more attention put on nursing homes.
That's what we're working on actively, yes.
And though a Wolf spokesman said recently, it's more complicated than giving more taxpayer funding to privately operated nursing homes. Notice he said privately operated.
Well, I'm not sure exactly what his characterization means. I think depending on how you define privately owned nursing homes, a nonprofit would also be...
It doesn't sound like yours.
Perhaps not. I don't want to put words in the spokesperson's mouth. But if we're talking about some of the providers that are not particularly good quality, we would agree with that. But the majority of the providers, whether they're for-profit or not-for-profit across the state, are providing excellent care, and we want to make sure that the funding is provided so they can continue to do that.
So we talked about Medicaid funding for nursing homes, and can you give me a rough percentage? You said they don't cover 100%. About how much do they cover on the average?
The MDOI payments cover about 47% of the nursing homes.
So nearly half.
Yes.
So I understand Medicare also comes into play as far as being another source of paying for nursing homes. And how much do they cover, and has that changed recently?
So Medicare will cover up to 100 days in a nursing home. Typically, though, the funding only covers about the first 30 days. But as changes in healthcare have come about in terms of what the hospitals are willing to help with, if the hospital, for Medicare to pay, someone has to have a 3-night stay or 3-day stay in a hospital prior to coming to a nursing home. And so sometimes that doesn't happen with the hospital. Sometimes they're discharged prior to that, and so they're not eligible for Medicare payments. But then oftentimes Medicare will pay for the first few days of a stay, but there's an encouragement to help get people back into their homes so they're aging in place again. And so the average Medicare stay is significantly shorter than that 100 days.
So I'm trying to visualize LeadingAge PA going to the Capitol and actually interfacing with these legislators. And just how many people do you have going to the Capitol? How big of a presence do you have?
Typically, we've got 2 or 3 people going to the Capitol on a regular basis. So we're not huge.
And you make appointments with lawmakers.
And oftentimes we try to make sure that our members are accompanying us as well, because we know the stories are much more vibrant if they hear what the impact is on a day-to-day basis, because some of them are really struggling. And because they exist because of their mission to serve older adults, they really struggle with these decisions of how to prepare or how to deal with these funding shortages.
So as far as you can tell, there is some degree of being receptive to your group's message, and that maybe there's hope for increasing Medicaid in the coming weeks for the budget.
We are hopeful, but we're not stopping our work anytime soon. We're going to be going till the last minute. I would say there's another issue, though, that is worth mentioning, and it's indirectly related to the budget, but it relates to Medicaid or medical assistance availability for assisted living services. And the real crux of it is Pennsylvania doesn't provide medical assistance funding for assisted living facilities. We're one of, as far as we know, 3 states in the country where that's true. The other 2 are Alabama and Kentucky. Not necessarily the company you want to keep from a regulatory standpoint, but what that ends up doing is people who come to assisted living facilities or personal care
homes. And refresh
homes.
me on what assisted living is, please.
Sure. Assisted living or personal care homes, they both exist in Pennsylvania. They're for people who have some care needs, but they don't need around-the-clock care. So assisted living facilities are licensed differently than personal care homes. And currently, because of the lack of funding, people generally don't license as assisted living facilities. So the requirements are different between personal care homes and assisted living facilities. Assisted living facilities have some requirements that require additional square footage in a room, some different bathroom square footages, bathroom availability for private rooms that personal care homes don't. And so legacy personal care homes haven't converted to assisted living because the funding hasn't been available. There's been no incentive to do so. So currently there are 50 assisted living facilities in the state of Pennsylvania, and there are thousands of personal care homes. The reason for that is this lack of funding. But the reason that it really matters to older adults is for an assisted living facility, once you run out of money, generally you've got nowhere to go. So if you're living in a for-profit assisted living facility, generally benevolence is provided and you'll be allowed to stay. Sometimes in some for-profit facilities, people are asked to leave. And so what ends up happening in some cases is that people are asked to leave. The only place that they can go and receive any care at all is in a skilled nursing facility. And the costs of a skilled nursing facility are more than double your typical personal care home facility, and so it costs the state more, and someone who could probably flourish in a care setting that is more independent in a personal care or assisted living facility end up in a skilled nursing facility, which is obviously much more clinically based. And so what we're trying to do is make sure that we can get Medicaid funding, medical assistance funding in Pennsylvania for assisted living. And in fact, there was a House bill introduced, House Bill 1442 by Representative Menser in Lancaster a couple of weeks ago. We hope that will come to the floor sometime soon.
All right, we've been talking with Adam Marles, President and CEO of LeadingAge PA. Thank you for your time.
Thank you.